Hello class, welcome to another pre-recorded lecture. I'm glad you're here today to listen to this lecture. And today we'll be talking about the spiritual care planning process, and we'll be discussing what that is today. The last two lectures that we have had, pre-recorded lectures, were the definition and importance of spiritual assessment. And then the last lecture, we talked about different spiritual assessment tools. Today, we'll be talking about the spiritual care planning process. What is the spiritual care planning process? And I hope that you're here to just absorb this information today. The spiritual care planning process starts with spiritual assessment. And from the previous lecture, we have learned that spiritual assessment is gathering, analyzing, and synthesizing, spiritual and religious information into a specific framework. And so spiritual assessment identifies religious and spiritual coping resources. What are the resources that are helpful to the patient or helping the patient to cope? Spiritual assessment helps identify resources, or identify sources of distress rather. So we're talking about distress such as spiritual, emotional, relational, grief, and comfort care issues, and so on. The spiritual assessment aids in the identification of the needs of the care recipient. So the spiritual assessment will, help us to know what the needs are. And as we understand what the needs are, then we are able to tailor the care planning to meet those needs. Spiritual assessment allows patients to identify spiritual beliefs, practices, and resources, because that is very important, because the spiritual care that is provided to a Catholic will be different from that which is provided to, say, a Muslim, or say a Jehovah's Witness, or say a Jew. And so having, information as it relates to the spiritual beliefs and practices and resources of the patient will definitely inform the spiritual care planning process. And so that's why the assessment is crucial to the spiritual care planning process, because the assessment elicits patients' thoughts and spiritual resources and coping, because we want to know what the patient's thoughts are, because again, the patient is the expert on his or her situation or lived experiences. And so again, we want to be able to get the patient thoughts so that we can provide patient-centered spiritual care. The spiritual assessment gives direction to subsequent care decisions. So the decisions that we're going to make, or the decisions that I make going forward, will be based on the needs identified in my spiritual assessment. And so if there are grief needs, then I'll provide grief resources. If there are, anxiety needs, then I will provide anxiety resources. The next in the process is interventions. So again, interventions are what we do to address the identified needs, because the assessment process helps identify the needs, and then the interventions now is where we tailor those interventions to be able to respond to those identified needs. The assessment informs the exploration of the exploration of the interventions that we're going to provide, such as whether that's going to be interventions related to, life resources, grief and emotional struggles, meaning and purpose, spiritual and relational, spirit, death and dying. It's very important that, we were able to tailor our interventions to those identified needs. Interventions can be life review, sharing of sacred stories, prayer, meditation, mindfulness, deep breathing, communion, listening, non-judgmental space, validation, and empathy. And also it could be like, sacred music. It could be reading of sacred text. It could be just general reflection. And so again, we make sure that our interventions are tailored to those identified needs. The next in the care planning process is outcomes. And so outcome is where I evaluate, or chaplains evaluate, how the patient and family respond to the intervention. So you ask and find out, how are they responding to those interventions, and you assess in the moment to see if patients and family members are able to express, feelings, emotional and spiritual relief, reduction in anxiety, making peace, or if there are unresolved issues that need further attention and exploration. If there are further issues that need attention and exploration, then we want to make sure that we go ahead and follow up as chaplains. Also, we want to make sure that we document those issues if they are grief issues, or if the patient is in pain, then we want to make sure that we check in with the nurse to see if something can be given for pain, and document that. You consult with the nurse to find out if the doctor can write an order to address the pain. And if there are anxiety issues that have not been resolved, then we want to say follow up to address anxiety. Patient is anxious about upcoming surgery, or is anxious about this new diagnosis, and so that the next chaplain coming in will have that on record and be able to provide appropriate support and care. I look in the outcome, I look to see if patients, families, and staff are coping better. Is there improvement in the patient's coping, or in a staff member's coping? So I asked us to see if they're able to cope better. And so that's outcomes. And we'll turn next to care plans. Care plans. Now that we have done the assessment, we have provided the interventions, and we have assessed the outcomes to see whether or not those interventions were effective, if the patients were able to express relief, if the patient if patient is coping better, then what is your plan? Your plan for follow-up care, or what is my plan for follow-up care? And so does the care recipient need a follow-up? So what I'll do, I'll document that in the records if follow-up is needed. So I make sure I check that in the patient documentation, and I'll put specifically why the follow-up is needed, to say follow-up to provide further grief support, or follow-up to provide anxiety support, or follow-up to explore spiritual resources. Or if it's a case where the patient was not in the room when you visited, then you want to make sure you say follow up to do spiritual assessment. Document your plan of care in the patient records. It's very important that you do that, because the visit did not take place if it was not documented. Again, you want to document the visit, document your assessment, document your interventions, and document your care care plan or your follow-up plan. That is very, very important to be able to address the needs of our patients. So again, the care planning process is a simple 4-step process, which starts with assessment, where you gather, you analyze, or you synthesize information related to spiritual and religious resources to be able to inform this, the subsequent care. And then the interventions is where you tailor, your interventions to those identified needs, to be able to, address those needs so that the patient can experience relief, that the patient can can be able to have resource to cope with what's going on. And outcomes is where you assess to see if the patient is able to express relief, if the patient is able to, if the patient is able to if the patient is coping better. And so that's very important that we do that. And then the care plan is where we say what's the plan of care going forward now that we know what the identified needs are, and know that we have provided these interventions, now that we know this is the outcome from those interventions, what's the plan of care going forward. And then we put those in the chart so that also the interdisciplinary team can have that information, and then they can see what's going on and being able as well to see if what we identify as sources of distress, if that can help to inform their care as well. And so again, thanks again for joining. The care planning is a very important part of the process of providing spiritual care. And so I hope that this was beneficial to you today, and I hope that you will use it and make good use of it in your spiritual care with patients and staff, and as well as families. Thanks for joining today. I'm glad that you tune in today.